evidence. A well-conducted literature search in an emerging field can have a good publication potential, especially when it's systematically synthesized and the status of the work completed. Before we start our session this morning, let me read some of the biodata of our panel for today's webinar. Dr. Anita Hisham is a senior librarian at TJ Danaraj Medical Library, University of Malaya Library. Her research interests include health science librarians, academic librarianship, evidence-based medicine searching evidence-based medicine searching skill, information retrieval skill, information and knowledge surveys, and information seeking behavior. She has been actively working together with the Faculty of Medicine, Dentistry, and Pharmacy in supporting their teaching and learning. She also provides consultation related to the literature search for systematic review for students and academicians. Ladies and gentlemen, if you have any question later, you can ask to our panel, Dr. Anita. You can just type your question in our Q&A box next to the chat box. I will read your question at the end of Dr. Anita's presentation. Without further ado, Dr. Anita, the mic is yours.
Okay, thank you, Dr. Faisal. Assalamualaikum and a very good morning. Ladies and gentlemen, first of all, I would like to thank Dr. Mo and PPP for inviting us today. I was also informed that there are many audience from various backgrounds who joined us today this morning. Thank you so much for joining. I hope that this session will be beneficial for everyone because I used to teach this session by request by the Faculty of Medicine for all the researchers and academicians and students in the faculty. So I was also given 45 minutes for this session. So it's going to be some sort of like introduction instead of a hands-on session. Yeah. So if let's say you are interested to have a hands-on session or consultation, maybe we can have that probably after this webinar session. Yeah, so this is just an introduction on how we are going to conduct a literature search for systematic review. Okay, so I hope everyone can bear with me for 45 minutes on this. Yeah, okay. So the content for today would be, I will be giving some introduction on systematic review because I am not sure how many of you have actually conducted a systematic review, or maybe this is the first time you are conducting a systematic review. So I think it's important for me to introduce to you what is a systematic review is all about, okay? And then I will go through some of the steps in conducting systematic review, and then probably how to develop the search strategy, because that is the most important stage in conducting a systematic review. And well, that is the topic for today, but I need to go through one by one first, okay, so that everyone can understand the whole process of conducting a systematic review. So I'll give you some take-home message, all right? Okay, so before I start presenting my slide, okay, I would like to share with you regarding this template. Okay, so for those who are, you know, for the first time you're going to conduct a systematic review, you should know that there are also Cochrane reviews. Okay, let's say if you are interested to publish your systematic review with Cochrane, okay, there is already a template for it. Okay, so you just need to use a template, and it will be conducted using a software called RefMan. Okay, so that is another way of conducting a systematic review. But let's say if you are just planning to conduct a systematic review and publish it in a common journal or normal journal publication, that is fine. That is also another way of doing it. So let's say if you are planning to do Cochrane review, okay, so this is how a Cochrane review looks like. Okay, so maybe for those who are not from the Faculty of Medicine, so probably this is something new for you. So I hope that you can actually try to see the whole process of coming out with in producing a systematic review. Yeah, so it's all the same, right? So they will have the abstract, And then for your information, they have this part here. So they will start with the background. Okay, the most important part I'm going to show you is the methods. Okay, so basically, this is the methods part. Okay, usually search strategy will be reported in the methods part. So it will also you need to report your which databases you search, and then your search duration, your timeline for your systematic review searching process. Okay, and then what are the languages, is there any restriction of languages and things like that. So basically that is what you need to report in a systematic review. Yeah, so you have you need to know which databases. Okay, later I will go through one by one. Okay, but this is just to show you this is how a Cochrane review looks like. Okay, for your information also, let's say you are interested to publish your systematic review, your review in a Cochrane review, you have to know that usually in a group, okay, there will be a subject group. Okay, for example, let's say you are interested to publish something on gastroenterology topic, okay, subject. So there will be a group for gastro. Okay, so in
Dr.
that,
Anita, do you have
yes.
slide to share?
Oh yes.
Because the participant
Oh,
didn't see the
okay.
slide.
Oh, all right. Sorry.
Perhaps you can start back
Yeah,
from
sure.
the beginning.
Oh, okay. I'm so sorry. I was so excited. Okay, yeah, so basically, okay, I'll just go through very quickly on this, yeah? So this is how a Cochrane review looks like, okay? So let's say you want to publish in a Cochrane review. So in that particular subject group, okay, for example, gastroenterology. So in that particular group, there will be an information specialist. So let's say if you are not sure, or you want to request, or you want to consult the information specialist, there will be one. All right, so if let's say you are conducting a systematic review and you want to publish it in a Cochrane review like this, you can do that. And then there will be some consultations from the expert, okay, the information specialist, the librarians lah. Okay, so yeah, I just want to show you quickly on that part that I missed just now. Yeah, so this is how it looks like. And then what we can actually say is that, okay, so this is the part that you need to know lah, okay, the search methods. Okay, this is where you will report everything. All right, the electronic searches, and then when was the duration of your search, and then probably the date you started, okay, and then is there any restriction? So everything will be reported here. So this is a Cochrane review. If let's say you want to publish a normal systematic review, like in a normal journal lah, okay, in a common journals, okay, so this is what you can actually do. All right, so this is how it looks like. All right, the same method, everything is the same. You still have methods, you still have results, conclusion, everything, but it's just that the way of searching is also a little bit different. Sometimes it's not that rigid lah, I would say, because if let's say you publish in a Cochrane review, probably the search strategy would be a little bit more rigid, I would say. So but if it's a normal systematic review and you want to publish it in a common journal like this, so probably it will be something more, not so complicated lah. Okay, all right, so example, yeah, so it will be published in a methods, and then sometimes you have to remember many reviews will have their search strategy highlighted in their paper. Okay, that sometimes they will publish it together as a supplement document lah. Okay, so for example, like this one, if let's say I download, okay, okay, let's say if I download, yeah, so there will be a search strategy, so you can actually have a look at their search strategy. Okay, so that is how the whole process of looking at the systematic review and how it looks like lah. So for those who are for the first timer lah, okay, so this is how a systematic review looks like. Okay, so I will move on to my slides. I hope Dr. Faisal, can you see my slide again? Can you?
Yes.
Okay, thanks. All right, so yeah, so the definitions of a systematic review. So a systematic review attempts to collate all empirical evidence that fits pre-specified criteria in order to answer a specific research question. It uses explicit systematic methods that are selected with a view to minimizing bias. So this is very, very important, yeah, because we want to reduce bias, okay, and then thus providing more reliable findings from which conclusion can be drawn and decision can be made. Okay, many systematic reviews also contain meta-analysis. So that part, okay, for meta-analysis, some statistical methods to summarize the results of the identified studies. So after systematic review, if let's say you want to have further analysis, that is something called meta-analysis. All right, so this is an example of definition by Cochrane Handbook. All right, so how does this work? Okay, so systematic reviews present stronger evidence compared to individual studies. So you will have individual studies over here. Okay, so many topics. So for example, like this topic here is on mental health, okay, of the healthcare workers during COVID. So there are many individual studies being published online now, okay, on COVID. Right? I think that there are so many at the moment. So you have you can actually just search for papers, right? But now, after some rigorous and systematic screening, selection, analysis, and reporting processes, after you have done every screening process, selection, analysis, and then you have the report and everything, so then you will produce a systematic review. So that is how it works. So from all the individual studies that you have found, that you have searched, you can produce a systematic review. So there is some few processes that you have to go through, and then it is important that you can actually, if it's good if you can produce a good systematic review. It's not just like producing a systematic review, because you need to do it systematically, I would say. All right. Okay. So I know that there are many from other faculties as well. For your information, I know that social sciences are also starting to publish systematic reviews in their field. Okay, so these are the examples. So it's not just because I know, because my experience was from the medical faculty, so I know that many are publishing systematic reviews. But for your information, there are also many papers or reviews coming from the social sciences as well. So no worries. So you can also publish systematic review now. Okay, so these are the example of reviews that are available. Okay, like for example, this I think just now was from automotive industry, and then like this one, the next one is from tourism. So and they publish systematic review. So that is something interesting to know that wow, actually people are actually publishing systematic review in various in very many disciplines, right? So it's interesting to know. Okay, so what are the differences between systematic review and literature review? So basically, of course, there are many differences. Okay, I'm just going to focus on the search strategy because that is our topic today. Okay, so systematic review requires a comprehensive search conducted in a systematic way. But literature review, if you notice that the strategy not explicitly stated. Okay, sometimes when you read a paper, sometimes the literature review don't really state what are the methods, how they search, how they come up with the results and all that, right? So, but for systematic review, when you want to report it, everything will be there. I mean, the whole process of retrieving the articles will be mentioned or stated in the paper. So there's some process that the search is a little bit more comprehensive, and I would say complicated a little bit. Okay, all right. So just to introduce to you here, so the reason why I need to mention this because sometimes we are not sure. Okay, if I'm just going to share with you, there are a few types of reviews. Okay, so one of it, systematic review, is just one part of the many reviews. Okay, so the first one is systematic reviews. Okay, commonly known among us in Malaysia. And then we have rapid reviews. I think this one, rapid reviews, many from the HTA, Health Technology Assessment Unit, are working on the rapid reviews. And then we have meta-analysis. Meta-analysis is something that you do when you finish your systematic review using the included studies. You conduct a meta-analysis because you want to further investigate on the findings. Okay, and then we have network meta-analysis, but this one to be honest, I haven't gone through this process yet, so I'm not sure how is the whole process for this. And then scoping review, okay, this is more descriptive. Okay, so let's say if you're just planning to explore, okay, you just want to see what are the I don't know, like for example, you just want to know what are the effectiveness of something, okay, and then you just want to see briefly how many are there in the world, for example. So that is scoping review. So you want to come up with a scoping review if, let's say, your review is just going to be very descriptive lah, I would say. Okay, so umbrella review, I also haven't conducted one yet, so I'm not sure on how is the process, but I've read about it. Okay, but it's just that I haven't gone through, so I'm not going to touch on that. Yeah, and then the living systematic review, you can actually read up on this. Okay, if you're interested to know. Okay. So why is it so important to conduct a systematic review? Because systematic review supports evidence-based practice and research. Okay, looking at this slide, sorry, I need to remove this. Okay, looking at this slide, this is the hierarchy of the quality of evidence. Okay, so all these are, okay, let me remove this first. I'm not sure whether it's, okay, all right, so looking at this is the level of the hierarchy, the quality of the evidence. Okay, so all these papers are the individual studies that I was saying just now. So these are all the study designs. Okay, you start with the expert opinions. Okay, then once the expert opinions are there, then case report, case series, and then you have cross-sectional studies, and then you have case control studies, and then you have cohort studies, randomized control trials. Okay, so these are all unfiltered information. Okay, so why is it so important for us to come up with a filtered information? So once you have filter all this, okay, from all the individual studies, you combine, and then you produce a systematic review. So systematic review is a filtered information, okay, and the highest level of evidence, okay, and also definitely meta-analysis. Okay, if let's say you have meta-analysis, then systematic review, then later will be meta-analysis. Okay, so that is the highest level of evidence. So that is why it's good if we produce systematic reviews, so it will actually help the clinicians to come up with the answers. Okay, this will really help the clinicians to answer their clinical questions. Okay, that is very, very important. Okay, so this is the systematic review process, okay, that everyone should know. Okay, first we usually determine the questions first. Okay, you have a questions, and then you plan for the review. So you need to write a protocol on this. Okay, and then you need to search for studies. All right, so I'm sorry if you don't really get this, because probably this would be a lot of things for the first time, for those who are doing this first time. So but I hope that along the way you will understand the whole process. Yeah, so you will search for studies, and then you have to sift through and select the studies. So it is called a screening process, and then you have to extract the data from the studies, and then you have to assess. Okay, you have to assess the quality of the studies, and then you combine the data, then you decide whether you want to do a meta-analysis or you want to synthesize it even deeper, okay, in depth. All right, and then you discuss and you conclude the overall findings, and then you can produce or publish a systematic review, and then you disseminate. Okay, so this one you can, after publishing the systematic review, then you can start disseminating. Okay, so these are the steps in conducting systematic review. All right, so this is something that I used to teach lah, okay, because it is more detailed. All right, so I will follow these steps in conducting systematic review. Yeah, so basically we will start with formulating question. Step 2 will be checking for recent systematic reviews, and then you will write and register the protocol, and then construct a reproducible search strategy, and then you need to conduct exhaustive searches. Step 6 is to organize and screen results. Step 7 is appraisal, okay, and then step 8 will be synthesizing the data, and finally you report and you publish the systematic review, right? Okay, so I will start with step 1. All right, the first step is to formulate question. It is very, very important that you need to know how to ask questions. Okay, you need to formulate an answerable question. Okay, it's not just like a question, but there is no there's no answer for it. Okay, the question has to be correct. Okay, the question has to be an answerable question. Okay, so this one the research question or the clinical question will typically be formulated by the content expert on the team. Okay, let's say if you're working on a systematic review with a team, okay, usually the expert, the clinicians will come up with the content, the research question or the clinical question, and then we will work on that. All right, because the reason is they are dealing with the patients. So sometimes they need answer, they need a quick answer, right? So sometimes when they are dealing with the patients, so they think that, oh, how do I know whether vitamin C is good for common cold, for example? So is there any evidence for that? So what they will do is that they will check for evidence. Okay, that means they will see whether there are any published systematic review to support whether vitamin C is effective for common cold, for example. That is a simple term lah. Okay, I would say. So so what they will do, they will check for systematic review. Okay, then it will support their decision making. All right, so that is an example of question. And then you also need to include the inclusion and exclusion criteria necessary to produce a narrow and answerable question. It is very, very important. Why? Why is it so important? Because this affect your search results. Okay, your information retrieval will be affected because of the sensitivity and the specificity. Okay, the reason, if let's say your question is too broad, okay, if you are conducting a systematic review and your question is too broad, the objectives are, there's too many objectives and things like that. So the tendency of getting a lot of articles, and then you might get irrelevant articles. Okay, there are tendency to get the too many papers, and then there will be irrelevant papers lah. Okay, but if let's say your question is narrow, okay, it is narrow, you might be able to get relevant papers, and also you will get few articles. So you have to see whether your question is correct or not. Okay, then only you have to decide your search strategy and everything. So make sure your your question should be correctly formulated lah. Okay, so that is how you do it. So I hope, I don't know whether I have questions or not. I don't know whether I should answer any of the questions now, but I think I will be able to answer at the end of the session, because we only have like 45 minutes today. But never mind. Okay, now I just continue with this first. Okay, so the example of an answerable question, okay, that I can share with you today. Easy one, okay, an easy question, which is, are antibiotics effective for treating the symptoms and reducing the potential complications associated with sore throat? Okay, this is very, very straightforward question lah. Okay, but that is a question that is answerable. Okay, whether it's effective or not. Okay, whether antibiotic is effective or not. So what we can actually do is that we formulate that question and we highlight the keywords into a PICO format. Okay, so for those who are familiar with PICO, I'm sure from the medicine they are familiar with PICO framework already by now. Okay, so this is PICO framework is actually to search for quantitative research review questions. Okay, so let's say if you're conducting a review, a systematic review that requires, you want to look at all the quantitative studies. Okay, so you can use PICO. All right, so it is important because based on this PICO, you will develop your search strategy. So that is very, very important. That's why I need to highlight all this in order for you to know the searching process later. Okay, so based on this PICO, okay, P is patient population. So you have to highlight all the so whatever you have found in the question. So who are the patients, who are the population in that particular question? Okay, whether it's old woman, older woman, okay, you elderly, or maybe women, men. Okay, so you have to state, okay, who are the patients. And then next is I is intervention. So this is where you have any like drug treatment, you have any screening tests, diagnostic tests, so these are the main intervention that you have. Okay, so for example, if let's say you want to look at the certain machines, for example, or maybe some drug, okay, and you want to see the effectiveness of that particular drug, so you can include that in intervention. And then comparison is something that if let's say you want to compare certain drugs, for example, or maybe certain techniques or methods. Okay, so if let's say there is a comparison, you can include that comparison. But if let's say you don't have any comparison, it's okay. You can just leave it blank. Okay, so if there's, for example, let's say placebo, or maybe you have standard therapy, and it can also be no treatment. Okay, you want to compare also can. All right, and then the outcome. So you have outcome, What are you trying to accomplish? Measure, improve, or affect? Okay, so you have to list down what are the outcomes that that this particular review is going to come up with. Okay, all right. So the variant of PICO is that S is for study design. So for example, this is PICO, right? So let's say if you have certain study design, for example, you only want to look at RCT, randomized control trials. So you need to include the study design. So you can filter it out at the end of your search strategy. Okay, and then let's say if you have peacock, okay, so C for context lah. So this one is usually for social science. Okay, let's say if you want to include C, is usually for social science, and then picot is for T is for time frame. So you have pico, and then later you can always what I say filter with this time, study design, or even context, right? So these are the different types of research question and study designs available. Okay, so let's say you are looking at the frequency of certain problems, then you will look for cohort study or cross-sectional studies. And if it's a diagnosis study, then you need to look for, so it's going to be like all cross-sectional studies, all right? If it's a prognosis and prediction studies, who will get the problem, then will be a cohort study, all right? So I think this one probably the people from the medical, or the audience from the medical might understand the whole process of this study design. Okay, and then if let's say you have etiology and risk factors, what causes the problem, that will be more on RCT, cohort study, case control study. And then if it's an intervention study, okay, then it will be randomized control trial. And then if it's a qualitative studies, then it will be something different already. Okay, so these are I just want to share with you what are the different types of research questions available and the study designs. Okay, so I just wanted to also share, because I know the audience today are from various faculties, so probably this might also be interesting for you, because besides PICO, there are also other frameworks available. Okay, so for example, if you are conducting qualitative evidence, for example, you can use SPICE. Okay, SPICE is something that that is also similar, but the way of they put that the components in the particular framework is a little bit different. So look at the S is setting, where P is the perspective, and then I is intervention. Okay, so it's different from PICO, a little bit different from PICO. All right, and then you have, okay, this one is actually Eclipse. Okay, I wanted to put this Eclipse. Sorry, this is not PICO. Okay, so Eclipse is something for if you want to search for health policies or management information. So this framework will be suitable. So it is important for everyone to use this framework before you start your search. Okay, all right. So I will share the slides with everyone later. I will pass it to Dr. Moh. Okay, all right. So example, again, Spider. Spider is also to search for health or qualitative research. You can also use this framework. And then we have Behemoth framework. This is basically for theories. Let's say if you want to explore theories, you want to work on the theories, you want to see, you want to analyze the theories that are available, you can use the Behemoth framework. And then we have SIMO. Okay, SIMO is basically for management, business, administrations. Okay, so that is different type of frameworks available. So you can actually just Google for the frameworks. Yeah, this is just an example of a few that commonly used. Okay, all right. So these are the example of the question just now. So are antibiotics effective for treating these symptoms and reducing the potential complications associated with sore throat? So as you can see here, so these are the intervention. Antibiotic is the drug, right? So you want to know whether this drug is effective to cure sore throat, for example. Okay, so sore throat will be patients with sore throat lah. Okay, so this is the population. So intervention will be antibiotics. All right, so there is no comparison for this study, for this question, because it's not like comparing with any other drugs. All right, and then the outcomes also, this is like just to reduce the outcome, the complications, the potential complications associated with sore throat. That's all. Okay, but you have to remember that you have to know how to put those information from the clinical question into PICO. All right, so you have to know how to break it down, all right, according to each component. Okay, so the next step in conducting systematic review is that you need to check for recent systematic reviews. All right, this part is usually what I will do is that I will just search every single, I'll do a preliminary search now, okay? I will just search for any papers available, and then I will see whether there are any systematic review or not. Okay, so what I will do, sometimes it's not even Google Scholar. I will search using Google. Okay, I will just Google it, and then what it will happen is that I will see whether is there any similar or existing systematic review, and then I'll move on to PubMed. Okay, I just want to see in PubMed, because PubMed you can actually filter. You can filter the search according to the study design, for example. So you can filter the search on systematic review. So I will go to PubMed and see whether is there any. And then I will also search in Prospero. I will introduce to you what is Prospero later. Yeah, so Prospero is also a I would say a repository of registered systematic reviews. Okay, so I will explain to you a little bit more on that. Okay, so this is also other resources that you can actually search for reviews. It is very important because we don't want to duplicate. We don't want to do a duplicate review. So in order for you to avoid that, we need to search whether is there already published reviews available online. So to avoid that, you need to search, do an extensive search, preliminary search to see whether is there any available reviews, because you don't want to repeat the same thing, because sometimes it is published like 2-3 years back, so I don't think you need to update. Okay, there are questions asking me sometimes, how many years considered like you can update the existing review. Sometimes the review is already published in 2010, for example. Yes, 2010 is doable because it's like 10 years back, right? So you can actually update. You can rerun again the search on that particular review. So you can do a search again. You can conduct the search again. But let's say if it's like just published, the systematic review is just published like last 2-3 years, or I think it's not necessarily to see. Sometimes it's not that many papers. There are not many papers published in that particular topic, for example. So it's very, very important to search for an existing systematic review. Okay, so these are the example also of reviews of resources that you can actually track. Yeah. Okay, so we have the third step, which is to write and register the protocol. All right, so you already know how to formulate the question, and then you check for existing reviews, okay, to see whether there is any available reviews online, and then decide. You decide and you have to register your protocol. Okay, so so this is an example, yeah. So this is an example of protocol. Let me see whether if I can click on this. Okay, so what does the Prospero protocol looks like? Okay, so why is it so important? So Prospero is, as I mentioned just now, is a repository that contains all the registered systematic review. It is important for you to register because you want to make sure that no one else is also going to do the same thing as yours. Sometimes systematic review can take like probably 6 to 1 year or maybe 2 years to publish a systematic review. Sometimes it can be even 3 months lah, if you focus on that particular review. But let's say if within that 6 to 12 months, for example, someone is also doing, so you are actually doing the same systematic review. So you just want to avoid that, right? So in order to avoid duplicates on the reviews that we are working on together at the same time, you need to register yours. Okay, once you register your systematic review in Prospero, so that people will know that will be your status will be ongoing studies. Okay, when it's ongoing studies, meaning people will know that, oh, okay, that means it's already being, someone is working on this topic already. So I think I'm not going to do this, that kind of thing. So it's important to register your systematic review. Okay. So this is the example of the protocol. Okay, so you have your review questions. Okay, you highlight what are your review questions. Remember, I told you just now the PICO. All right, you can just highlight your PICO over here, and then you have to mention which databases you are going to perform. Okay, your searches at, and then what are the dates of your duration of the search. Probably like you want to stop your search until okay, now it's September, so probably your search will be until now, for example, and then the language. All right, so you can also include the search strategy. Okay, so this is how a search strategy looks like. Yeah, so yeah, so you can also include this so people can see. Okay, oh, okay, there's already someone looking at this, and your angle, your maybe your the way how you are looking at this review. Okay, so maybe people will know better. Okay, and then maybe they can do something else. Okay, maybe the same topic but looking at different angle lah. Okay, all right, so then you have to highlight the inclusion exclusion criteria, and then you have to state the participants, the population, and all that. So this is how a protocol looks like. So very basic. Okay, it's just to mention that this is what I'm going to do. Okay, this is what we are working on. All right, just that. Okay. Sorry, where was it again? Okay, so this is where you can register your protocol. Okay, so this is Prospero. Yeah, so you can just Google for Prospero. I hope you can jot down also if let's say you can't remember the name of this website. Yeah, so this is something that you can actually look at and also register. Okay, talking about databases. There are many databases that we use to conduct systematic review. I understand that in our university, for example, in we do not have certain databases that we use for systematic review, but no worries, because there are some other databases that you can actually use. Okay, so we have CINAL we have in our subscription. Yeah, so CINAL is one of the database. So please try to get used to our published databases in subscribe at the university, because it's quite expensive actually. So due to some budget restrictions, we can't afford to subscribe to certain databases. I know that many of y'all are looking forward for Embase database, but I don't know, because of the budget restriction, we can't work on that that part. Yeah, so but we will try to see whether, you know, in the future we can try to subscribe Embase. And then we have Lilac. Okay, so back to CINAL. Yeah, CINAL is something related to allied health sciences. Okay, for example, if you are from nursing can actually search from CINAL. Okay, the databases will have more on the allied health sciences subjects. Okay, and then Embase. The reason why everyone is asking Embase is because that will have it consists of papers related to European papers, okay, European articles or journals. Okay, that is why many of the researchers here are looking forward to Embase actually. And then we have Lilac. Lilac is more on the Latin studies. And then Pedro is more on physiotherapy. Okay, this is free online. You can just, it's an open access database. You can actually just search without any subscription, even Lilac, all right? So we have Web of Science. Library, subscribe to Web of Science. Okay, we have access to it. You can use that. Okay, then we have PubMed. Okay, there are questions asking me whether what is the differences between PubMed and Medline? Okay, for those who are familiar, so PubMed is an open access database. Okay, whereas Medline is a subscribed database. So either one, you can actually use either one, all right, to search. Okay, from my experience, I've actually searched using PubMed and published the review. But there was also recently, there was one of my colleague from UPM. She said that, oh, I have published, I've searched in both, meaning that she searched in PubMed and also Medline. So it's okay. So she said, accepted. So I think there are some, you know, you have to really look at it again and see, is it necessarily to have both in your review? Because sometimes PubMed and Medline is the same. It's from US. Okay, so probably there might be some duplicates lah. Okay, there'll be a lot of duplicates actually, but it's just that Medline is more subscribed papers lah. Okay. And then clinical trials, this is for all the clinical studies, the trials that you want to look at. And then Scopus. Scopus is also one of the platform for you to conduct your systematic review search. And then another one is CNKI. CNKI is something related to Chinese studies. Okay, for those who are doing, like, for example, you're looking at Asian studies, for example, right? You can use CNKI. All right, and also this one is called Global Index Medicus. Okay, World Health Organization Global Index Medicus. So this is also studies that has, like, the statistics and all that. So it will also cover a quite huge coverage on these countries and all that. So you can also use this. Yeah. Okay, Sport Discuss. This is more towards the sports medicine. Okay, so we don't have this now. Okay, I remember we used to have Sport Discuss, but we have to unsubscribe to it. Okay, and then we have PsyInfo. PsyInfo is also more on psychology. Okay, and then Google Scholar. There are different views on this. Yeah, some people say that no, we can't really use Google Scholar as your platform to search. But if you ask me, I think it's okay. There are reviews that has been accepted, and the Google Scholars was one of the platform to search for that particular review. So I think it's okay to search in Google Scholar. Okay, and then we use Cochrane. Okay, Cochrane is also another platform. It's free. Everyone can use because National Institute of Health Malaysia subscribe. Okay, the Ministry of Health have actually subscribed this for us. Please try to access this Cochrane library. Okay, I'm doing some promotion over here. All right, so that everyone are familiar with all the databases that we subscribe. Yeah, and then engineering, IEEE. For those who are from engineering, maybe you want to conduct a systematic review. IEEE is one of the database. Okay, you can actually look at the database to conduct your search. Okay, so there are many databases that you can actually use to subscribe to do your search, but it's just that you must know which databases that are like this. Okay, like you have a quite huge number of papers available in that particular database. Okay, I hope this one is clear. Yeah, so if you have questions, I can see there's 65 chats over here. I'm not sure what is the question over there, but it's okay. I'm just going to reserve that my comments on that later. Okay, all right, so grey literature. Once you have conducted your search in databases, so next you move on to grey literature, because we don't want to miss any papers available online or published or unpublished, right? So basically what we will do is that we want to make sure we retrieve papers, published papers, and also unpublished papers. Okay, unpublished research. Okay, so this is where we call grey literature. So these are you can actually Google, yeah, you can actually Google for Open Grey, GreyNet, and Grey Literature Report. So these are the three common ones that you can actually search. This will consist of what do you call that? Conference proceedings, meetings, dissertations, technical reports, and all that. So if let's say you want to still search, you can Google for these three. Okay, you can get. I'm not going to go in detail lah. Okay. You can also go to the government agencies' websites, and also MyMedR. Yes, so this is I know this is from the Academy Family Physician group that they have actually worked on this, which is called Malaysian Medical Repository. So this is something that more towards Malaysian research lah. Okay, so but they I think they extract that from PubMed also, but they focus on Malaysian studies. So which is quite interesting to look at because you don't want to miss papers from Malaysia as well, right? Okay, so and then you look at the World Health Organization website, NIH Reporter, and then ProQuest. We do have ProQuest. We subscribe to ProQuest dissertation and theses. So this is something that if you're not familiar with, please get familiar now. So ProQuest is a database that we subscribe. You can just click for in our A to Z databases, and then you can retrieve so many theses and dissertations that are available online. Okay, instead of just publications, theses that we usually search from our repository, this is global. Okay, international published dissertation and thesis. So you can get this from our databases, okay, A to Z databases. Okay, so I move to the next step, which is to construct a reproducible search strategy. Okay, so once you already formulate your questions, you have searched your search, you have done a preliminary search, and then you write and register the protocol, then you start your search strategy. Okay, this is where you need to develop a proper search strategy. So I'm just going to use the same example just now. So I'm talking about antibiotics and my sore throat. So basically, we have PICO, right? So from PICO, I name this as concept, yeah. So because I'm a librarian, right? So we used to do this as concept 1, concept 2, concept 3, and all that. So basically, for search, we use concept. Okay, so we have concept 1 is sore throat, concept 2 is antibiotic. So based on this PICO, I am going to develop my search strategy. Okay, so that's what I'm going to do right now. Okay, before I show you the example, this is something that you can actually just Google. Okay, this is a template that is, I think it's commonly used in many universities. I think they are teaching this already, where you need to have a template for particularly for search. Okay, you need to have a particular search strategy worksheet, for example, because you need to show this. For example, let's say if you want to present this to your supervisors or your team, you can just show them, oh, okay, look at this, this is my concept, okay, this is my keywords, and then this is my control vocab. Okay, so what is key concept? So key concept is the one that I mentioned just now from PICO. Okay, you just highlight your concepts. And then free text term. What is free text term? Free text term is something, all the alternative term or similar or synonyms words to this particular concept. I'll show you the example later. Okay, so for control vocab terms is mesh. Mesh is one of the control vocab terms lah. Okay, so medical subject heading. All right, so I'm just going to show you the example. So once you already identified the concept, now you need to find as many alternative terms as possible. Any layman term, okay? Any layman term that you can think of. And also you need to make sure that your free text term also being commonly used. So how to know, how to get all these terms? How do I know? I'm not familiar with that term. Okay, so how do I know what are the alternative terms that we can use? So what is the place that you can actually search is from the online thesaurus. Okay, online thesaurus, if let's say like this one is a generic one. Okay, if it's a generic term that you need to search, you can use this online thesaurus, okay, to search for synonyms, or a dictionary. You know, you have many other platforms that you can search for synonyms. Let's say if it's a medical based term, okay, medical term, then you need to go to the medical dictionary, medical thesaurus, and all that. So that is where you search for synonyms. Okay, so another techniques, another tips I would say how to search for synonyms is that you have done your preliminary search, right? Look at their papers and see the abstract, and then look at their keywords. Okay, you know, you have abstract and then you have your keywords, right? See what are the terms that they use. Sometimes it's very useful because we won't be able to think of that particular keyword also, you know, so sometimes it's very helpful, and we can take that and include that in your search. Okay, so it's either way around lah. So it's whether you look at the keywords or maybe you look at the title. Sometimes the title also will help to give you the proper synonyms. Okay, so what is controlled vocabulary terms? Okay, medical subject heading is just an example. Yeah, so this is a standard terminology used by indexer. Okay, so for example, PubMed. Okay, if some of you may be familiar with PubMed, right? So PubMed got many, you know, papers available. You know, when you retrieve the article, it's there's many available articles online. But medical subject heading, National Library of Medicine, they have their own information specialists. They are the librarians. They have the indexers. Okay, so they will index the particular keyword and give it a terminology. Okay, they will come up with a particular subject heading for that. So this is what I think I will show you lah. Okay, later. Probably you can't really get into this yet because it's just a theory part, but that is it lah. Okay, so medical subject heading is something being indexed by the librarian from the medical National Library of Medicine. Okay, so they will give a terminology, the standard terminology. Okay, so yeah, because this one is to enhance the retrieval of best evidence lah. Okay, so for Medline, Sinal, Cochrane, we call it as medical subject heading. Okay, if it's Embase, if you are performing your search in Embase database, it is called M3. Okay, all right. So where is mesh located? Okay, where is it? Where can you find mesh? Okay, so PubMed. Okay, when you Google PubMed, you can actually scroll down. There is one function here. Okay, you can see mesh database, explore mesh database. So that is where you search for mesh. All right. Okay, so this is an example of how to get mesh without going to the website also sometimes. Okay, sometimes you just want a quick search, kan? So what I will usually do, I will just search any keyword in my PubMed search box. Then I will just click on any of the results. And then what I will do is that I will scroll down. If you notice, there will be mesh terms. Okay, now I think the mesh is on your right. Okay, so you just click on mesh terms. You can see what are the mesh you used for this particular paper. Okay, so for example, this is something on pharyngitis, right? So pharyngitis, I click on this, you can see mesh. Okay, so mesh got adult, analgesic, and then they have child preschool, pharyngitis, and all that. So they have streptococcal infection and all that. So these are the terms that they use for this particular paper. Okay, so when I click, for example, on the pharyngitis, okay, when I click on this, it will bring me to the mesh mesh page, okay, where you can read the description. There's some description on what is pharyngitis, and then there will be some subheading. So let's say your topic is something on, okay, like this one, right? Pharyngitis, but they only look at diagnosis, and also they look at drug therapy. So this is where they get all that information from. Okay, it's called subheading. All right, so this is where they got all the information. So the system will search only for pharyngitis, but looking at the diagnosis and drug therapy. I know that I'm running out of time. I will try to hurry up. Yeah, so I hope you also can stay with me for another maybe 10 minutes. I'll try to finish by 10 minutes. Yeah, Dr. Faizal, is it okay?
Yep, we have quite a number of questions actually.
Okay, should I address the question now or later?
It's up to you. If you have more slide to go, we can finish
the slide first. I think I'll do it at the end. Yeah.
Okay.
Thank you, Dr. Faizal. All right. So so Boolean operator. This is something very, very useful when we want to conduct your search strategy. You have to at least know what is and, or, and not. Okay, when you want to conduct your search strategy, you want to develop a search strategy, you need to use this combination. But I would suggest not to use not first. Okay, just use or and in your search strategy. So because if you use or, you will get at least either one of this term. Okay, for example, you have maybe you have just now antibiotic, and then you have penicillin, for example. So you will get two. Either one, okay, either penicillin or antibiotics in your search results. Let's say if it's you're using N, so the result will combine. So N will be used for concept 1 and concept 2. So you will make sure that both terms appears in your search results. So for example, you have sore throat and antibiotic, right? So you want both terms to be available in your or appear in your search results. You need to use and. Okay, not is usually I don't really recommend to use not lah. Okay, let's say if you have for example, like you are doing a study focusing on women, for example, but sometimes in the paper, the results, there will be men included in the results. So you want to remove that. Okay, so you can just put not. Okay, all right, so this is an example. Yeah, so how you want to add mesh and free text word. So for population, concept 1, Okay, so we have all the ORs. Okay, TIAB is a short form for title abstract. I have to tell you this because this is very important, because we have actually analyzed this before, and we have published the paper on this. We want to make sure that when you do your search, you include title abstract as your filter, not all fields. If you realize when you search, all field will actually capture so many things in particular in that particular paper. So if you highlight only you want on title or abstract, the paper will only, the results will only appear with the sore throat. Sore throat will only appear in the title or abstract of the research articles. Okay, meaning that when your search result is out, you can only see the sore throat and sore throat. It will be appeared in the title or abstract. Okay, so we have all the ORs here. Okay, you have to combine. So one concept, you have to combine OR, and then you include your mesh. So I'm so sorry that I can't really show you the hands-on. Usually I will have this session with an hands-on, actually with the hands-on session, but this is like introduction to this, so I have to like just share with you. We can have another session if, let's say, if you're interested to have a hands-on one lah. Okay, all right, a smaller group for hands-on. Okay, so and then we include title, abstract, and then pharyngitis as the mesh. Okay, and then we have intervention, the concept 2, which is antibiotics, and then we have mesh. So all the same concept, we combine it with OR. Okay, so we have concept 1 and concept 2. Okay, combination of mesh and free text word. Okay, then we move on to putting it all together. How are you going to combine it? So concept 1 and concept 2, remember I said you want both concepts to appear in that title or abstract, right? So what you need to do, you have to combine it with N. Okay, so same concept, you have to combine with OR, same concept, you combine it with OR, and then you end it. Okay, you include N as your final Boolean operator. Okay, so this is how a complete search strategy looks like. So this is how a complete search strategy looks like. Yeah, so this is concept 1, and then you have the N, and then you have the concept 2, okay, all the ORs, okay? So yeah, so basically this is something that will appear in your PubMed search history. Okay, so you search one by one. You want to make sure your search strategy for systematic review is systematically done. Okay, because we don't want to miss any papers. Okay, we don't want to miss any keywords, and then we don't want to miss, and then we don't want to mix up with all the keywords, because you can see this as like one, it looks messy, right? But we have to make sure if you do it properly, you do it one by one, definitely you can get used to it lah. Okay, it will be okay for you. All right, so the next step is to conduct an exhaustive search, meaning that you need to replicate. Okay, one tips here is that I will make sure I conduct my search in PubMed first, and then I will rerun again, refine, and if I'm not happy with the search result, I will get back to the content expert, and I'll get them to see the review and then the search strategy, and ask them for their opinion to advise me on the keywords that I've selected. Sometimes it is not suitable, sometimes it's too broad, sometimes it's too narrow, so I will get some consultation. So basically for you, for the audience today, if let's say you want to check your systematic review search strategy, you can consult the librarians. Okay, we are here to help you on that part. Okay, we can assist you with that part. Yeah, so you can consult us. Okay, so once you already have your search strategy for PubMed, for example, okay, then you replicate all the search in other databases. Remember, I told you just now, we have so many other databases, right? Okay, there are some questions asking me. I'm not sure whether you have asked me the questions or not in the 80 chats over there, I can see. Okay, if you want to know how many databases is sufficient. Okay, I don't really give a good number on that lah. Okay, sometimes there are reviews actually published using two databases, but I would suggest at least use three or more. Okay, three or maybe 3 to 5. Okay, that is a good number of a database that you need to search, because if not, you might miss a lot of papers, one, and then sometimes if it's too many databases, you might get a lot of findings. If it's a topic that is not commonly used, and then probably it's quite hard to find papers probably in that two databases, then you consider using more databases. So that is how you have to decide. The decision is yours. Actually, you have to play around with your search strategy, because my example just now is very simple question actually. So if let's say you have a complicated question, you need to make sure you know where to search and which databases that you can go and search. Okay, all right. So yes, there is a question sometimes asking me what is a good number? Okay, what is a good number? I mean the total. To be honest, I've gone through experience with my friends from the researchers here. Some of them has actually go through like they managed to get like 14,000 results. Okay, but sometimes you have to make sure you have to check back again your search strategy and see whether it is correctly done, or sometimes there are some things that you don't need to include. Then you have to refine your search strategy again. Okay, so that is very important. Get some consultations from the experts in order for you to refine your search. Okay, all right, so this is the example. So let's say you want to replicate your search strategy, so you replicate that in the other databases. So this is how you do it. So another database, then you use the same search strategy to search in other databases. But you have to remember, different databases have different style of searching, and they have different technique of searching. Sometimes they also have different so how to know what are the differences and all? Click on the help button. Okay, help button is very useful to see what are the symbols that they use. Okay, what are the Boolean operators, how they input the Boolean operators and things like that. So you can just search for the from the help button. Okay, if you need more help lah, okay, on that. Because honestly, to be honest, if it's the first time, even for me, it was very hard actually to understand the whole process until you used to do doing the systematic review for a few times. Then only you will get the momentum. Okay, you will know the flow and you know what to do. All right, so that is very important to. If it's your first time, don't worry. Sometimes it's just like, you'll be like a little bit, feel that it's very tedious, but sometimes it's not tedious actually. It's just, you need some time. You just need time to do this. Okay. And you need patience. You need patience to do this, to be honest. Okay. All right. So beyond databases. So you already search in unpublished and published databases, right? In papers, right? So what you do next is you need to do some extra work on forward and backward citation tracking. So this is to follow up references from reference lists of relevant articles. Okay, so this is something that usually happens when, let's say you have found the included studies and you think that I think there must be something else. And then sometimes it's like, no, I think there must be some other studies available. So from the included studies, look at the references and you look at the studies and you search. Okay, there is another technique. The technique is using Google Scholar and also Web of Science. You can see what are the papers that has actually cited the included papers. Okay, I know it's a little bit confusing, but that's it. Okay, so yeah, all right. So the system. So the sixth step is that to organize and screen the results. So this step, okay, once you already have your search results, where are you going to input, keep all this? Where are you going to store all this? So this is where you organize and screen results stage, where you will export all this into your reference software manager. Okay, it's either Mendeley or EndNote. Okay, but we subscribe to EndNote, so you can use EndNote as your software tool to organize your findings, your results. Okay, so this tool will actually allow you to remove duplicates, and then you can search and sort the results. Okay, so this is an example, yeah. So this is an example of EndNote 20. Okay, so let's say you already searched. Okay, can you see databases over here? So let's say you have searched from CINAL, you managed to get 110, and then Cochrane, you search 157, Google Scholar 91, PubMed 1509, Science Direct 315, right? So what you can actually do is that you can create folders under databases, and you export all those findings into these databases. Okay, and then you can create another folder looking at the screening, only on screening. So what you can actually do is that you will need to drag and drop. So you have the total of references over here is 2,373, right? So what you actually need to do is that you need to drag and drop. Let's say if you want to include the first paper, okay, you drag and you drop, you include it. Let's say if you are interested with the second paper, okay, include. Let's say if you don't want this paper, looking at this title, looks like it's not that relevant, you exclude. If you are unsure, if you want to get your teammate to track, you put it under unsure. Useful is also important. Yeah, I've also learned this that recently, that you should create another folder which is called useful, because this will be actually useful for literature review writing for your background. Okay, when you want to write your background, the useful folder is very, very useful, okay, because you want to write that particular topic on that topic, so you can actually use the paper to write or cite. Okay, so I hope this one is clear. Okay, all right. Yeah, I think I have like few more slides. Okay, so another thing that I want to share with you is that this is called Prisma flowchart. Where are you going to report this? Okay, once you have found all these results, okay, from EndNote, this is where you also duplicate. Yeah, from this 2,300, sometimes there will be some duplicates here. Okay, there will be so many duplicates over here. So this is where you can remove duplicates. Okay, you can use the software manager to remove duplicates. For your information, there is also other tools available like Confidence and all that, but it's just that I don't really use that yet, but I know that it's there. Okay, you can actually use Confidence. I think there is one called Abstractor. Okay, so that are all the softwares that you can actually use. Okay, all right. So move on to this. So this one is you want to report your items for systematic review and your screening and selection flow diagram. Okay, so this is how the Prisma flowchart looks like. Okay, for your information, this is the latest one here. It is being published in 2020. Okay, it was just published last year. Yeah, so I think there are 4 types of flowchart. You can Google, I think I'll show you later, where they have separated, if you can see here, Prisma flow diagram for new systematic reviews, which included searches of databases and registers only. Okay, and another one is of databases and registered and others resources, something like that. And then there is another one, flow diagram like this, focuses on updated existing review. So they have actually separated between the new systematic review and also the, if you want to update the existing review, there is another flow diagram, flow chart. Okay, all right. So this is where you need to include how many papers you have obtained or retrieved from PubMed. Okay, you have to mention it here. The total number, PubMed, CINAL, and then Cochrane, Science Direct, Google Scholar, for example. Okay, and then you have to make sure there are reasons why you remove them from your study. Okay, you have to write, you have to jot down everything. So make sure when you are doing your screening, make sure you write somewhere okay, make sure you write somewhere on the numbers here. Okay. All right. So this is the for searching. Okay, this is the checklist. Okay, this is called Prisma checklist, but this is specifically looking at the search strategy. So let's say if you want to know whether your search strategy is sufficient enough or not, whether you have covered everything, okay, your coverage, and then whether you have done whatever you're supposed to do, okay, you can use this checklist as your reference, okay, to see whether you have listed your databases name here, and then you check. And then, for example, you have done your citation tracking, you check. And then, for example, let's say you have other methods used for the searching, then you check here, okay? So this is the checklist. It is important to actually look at this. Sometimes researchers will ask me like how to know whether what is it, yeah, as I said just now, right, what is a good number. There is no answer for that. Sometimes certain questions need there will be many papers to answer that question. Sometimes there will be only like less than 200 papers, okay? Sometimes there are 200 papers, sometimes there are 2000 papers results to answer that question. So there are no answer, there are no specific answer for that, okay? As long as you know your search strategy is sufficient and it's good enough, then should be okay, all right? If it's too much, maybe like sometimes 14, 15, 20,000, there's something wrong with your search strategy, okay? Just think like that, okay? You try to adjust your search strategy. Okay, so the final 3 steps is that appraise, okay? So this is all the clinicians work, okay? Where they are the content experts, right? So, and then we include the statistician. Sometimes your search systematic review will require a statistician to look at the methods, the analysis. So this is what they will do. So they will appraise the data, and then they will extract the data, okay? So that is what they will do. And then we have the synthesize, okay? After that, they will synthesize the data to see whether they need to perform meta-analysis or not after that. And then finally, you report and you publish. So all team members should be involved. So with the writing of the manuscript, sometimes you need the content expert, maybe the main authors, because they will be the expert for the subject. And then the librarian or the information specialist should be the method section, okay, because they are the ones in charge for the literature section, literature search part. And then the statistician, sometimes they will be able to help with the analysis part. Okay, yeah, so take home message, a quick one. These are the tips for you, for those who are interested to conduct a search strategy. Remember to use phrase searching. When you want to search something, for example, high temperature as one keyword, you need to use the inverted comma as one term, okay? If not, if you don't use the inverted comma, sometimes high will be in one corner and then temperature will be in one corner. So let's say if you you instruct the system to use the inverted comma, you can search high temperature as one term. Okay, same goes for smoking cessation. Okay, truncation. This is something that different from other databases as well. Okay, so different databases use different techniques of truncations and wildcards. Okay, truncation is also important, yeah. So for example, if you're using a root word, something like compute, the system will search for compute, computers, computed, computing. Okay, but if let's say if you're using wildcards, this will replace this alphabet over here. For example, like leukemia, you will replace with AE, okay? Usually we type here E, right? So if you put an asterisk in the middle, the system will search AE. But you have to remember, sometimes you don't need to do this because the system is a little bit more advanced right now. Sometimes it can detect both spelling, okay? Okay, this is also another thing called search filters and hedges. Okay, this is what we call the the search filters according to the search design, study design. Okay, so for example, if you are doing a system, if you are looking for papers on RCT, randomized control trial, this is what you need to include as your study search filter lah. Okay, so you can, it's already templated already, so you can just copy. So sometimes you can just Google and see what are the search filters template for this, and then you can just include this at the end of your search result. Okay, and then finally, not finally, okay, another two, I think there's another two. Okay, so you need to use the combination of title, abstract, and controlled vocabulary terms when you want to conduct a systematic review. Okay, it is a must, but let's say if there is not really many match terms, it's fine. Okay, but if there is, you need to include that. Okay, please use title, abstract as your keyword. Okay, and then yeah, find similar reviews, find similar existing reviews, and look at their search strategy. This is a tips, yeah. So let's say if you want to conduct a search strategy for a systematic review, you need to make sure that you have done your preliminary research, look at their search strategy. Sometimes they will share it in the supplement document or materials. So you can just click on that and look what are the terms that they use. So for example, like this one, this is PubMed search strategy. This is a website where you can actually just click on this and there will be a template for that particular keyword, for example. So that this one is rheumatoid arthritis, right? So these are the search term or the search string for rheumatoid arthritis. Okay, you can actually use this, for example. Okay, so finally, so there are no perfect search strategies developed for the first time. It is important to refine. So it's easy to do it, okay? But I'm just going to finally just share with you one thing, which is known as this, okay, errors. Okay, I want to highlight the errors here, because when you want to conduct search strategy, you need to know it is important to look at the errors. Okay, sometimes when your search results is not that you're not happy with the search result, so there must be something wrong with your search strategy. So look at the truncation. Sometimes there are no truncation, and then sometimes your truncation error. Okay, you include the inverted comma. Sometimes you don't put the asterisk. Okay, and then sometimes your mesh is wrongly included in the search strategy. And then sometimes there are also issues that you forgot to put your or and all that. Sometimes you miss certain keywords, so it's good to see this. I'll share this paper with everyone to see what are the things that you might make errors lah in your search strategy. Okay, so I think with that, I thank everyone for your attention. I know it's already like 11:18. So Dr. Faisal, can we okay.
Can we have a quick Q&A session, Dr. Anita?
Oh wow, there is many questions.
Yeah, we will try our best. The first question is come from Sharifah Shaharbuddin. Is there any guideline to how many paper that need to be reviewed to produce a systematic review paper?
How many, sorry?
How many papers that need to be reviewed?
Oh, okay. Yeah. So yeah, I was mentioning just now. I mentioned just now that there is no good numbers. Okay, to review. Sometimes once you got, for example, you got 2,000 research papers that you want to include, right? So from that 2,000, probably you include. You do the screening, probably there will be like 200 papers that you want to screen. That means you want to do the analysis, kan? So it sometimes can go to, okay, to be honest, I've gone through a scenario where there is only 2 papers finally included. So that 2 papers cannot be they cannot proceed with the findings and publish because it will cause bias. Okay, when there is bias, it's very, very dangerous that there's no there's no finding and outcome of that. So it's very hard to publish. Yeah.
Okay. From Sue Ligo, may I know who is the information expert for Cochrane Systematic Review? Are they in-house staff or part of the research team?
Okay, so Cochrane Review, for example, if you are planning to publish Cochrane Review, what you can actually do is that you need to contact the group. Okay, sometimes, for example, I mentioned just now, for example, infectious disease. There is a group that are in charge for infectious disease. So what you can actually do, you can contact them. So what you have the RefMan as your platform to search, right? Your software. So what you can actually do is you can get their advice. Okay, you come up with your search strategy, they can actually check for you, and sometimes they even do it for you. I think. Okay, you can check with them. Yeah.
All right. From anonymous attendee, dear Dr. Anita, does SR require validation or reliability checking like a research study?
Yes. Okay. So what I can say is that when you're conducting a systematic review, every stage will have some validation you have to do. Okay. So for example, you have your PICO and all that, right? So you have PICO, you have your search strategy. It's good, for example, like for the searching part, get the librarians to help you with that. Okay, sometimes the librarians will know better in terms of the search. Okay, we know better in terms of the search. We will advise you on that. So please validate your search strategy as well.
Okay, short and
Yeah.
sweet. From Hemalta, kindly brief what are the steps in the hierarchy need to be considered to computer science as LA?
S.
SLA, systematic
Oh.
literature review. Systematic
Oh,
literature.
SLR.
Yeah,
Okay. Oh, okay. So.
this is SLA. I'm not sure.
Oh, okay.
It's
I
supposed to
think
be
it's
SLR or
SLR.
yeah.
Yeah, okay. I think it's SLR code. Okay.
Mhm,
All right. Thank you for the question. So as what I mentioned just now, the techniques, it will be the same. Okay. But
mhm,
you need the process of the analysis will be a little bit different. Okay.
mhm,
Because for medicine, they need the expert to come up with the decision and all that, because the analysis will be a little bit more complicated, I would say.
mhm.
But for social sciences, probably it's quite I think you still need the expert to come up with the search and all that. Yeah, you need to validate with the experts lah, I would say. Yeah.
Okay. From Pranita, does the systematic review protocol need to be published? If so, where and why?
Okay. As I mentioned just now, protocol need to be registered. Okay, that is the answer. It
Mhm,
need to be registered in Prospero. Okay,
mhm,
and then there are possibility for you to publish a protocol. Systematic
mhm,
review protocol can be published. Okay,
mhm.
from my experience with one of the researchers here, they publish protocols, so you can. Okay, you can publish.
All right. From Hafiz Idrus, how to merge previous concept in book with latest article data?
That will be other resources. So for example, you have searched all the databases and then you search in gray literature, you have done your forward, backward citation tracking. So
Mhm.
other than that will be other resources.
All
Okay.
right. From
Yeah.
Raidan, what is the difference between systematic review and scoping review?
Okay, scoping review is very brief. Okay, it's a very descriptive review. The process and everything is the same. Okay, you still
Mhm,
need your PICO and all that, but
mhm.
it's just that it's the topic. Sometimes the question will be different.
All
Okay,
right.
because systematic review you need to analyze it in detail. Okay, because you are looking for a finding out of it, right? But
All right.
scoping review, you just want to descriptively look at the findings that are available and things like that. You just want to report it just like that.
Okay. From Shi Yang Tan, in systematic review question formation, is it okay to form question that does not have a yes or no answer? Is it okay
Sorry,
from
Dr. Faisal, again, sorry.
in systematic review question formation, is it okay to form
Okay.
question that does not have yes or no answer? Is it okay to form question that are descriptive? For example, what is the treatment protocol for certain disease?
Yeah, can. You can. That's why you have to be sure whether whether that particular question or it usually it's a question now. Okay, when it's a question, you must see whether it really answers that question or not. You have to see whether the outcomes. You have to look at the outcomes, whether that outcomes is actually answering to that question or not. Okay, so that is why you have to decide whether you want to do a scoping review or just you want to conduct a systematic review or a scoping review. That's why early stage you have to read up a little bit on what are scoping reviews and what are systematic review and also rapid reviews. So there are three things that are similar. So and commonly used among our Malaysians. So this is what you need to read out a little bit more on that.
All right.
Yeah.
Before we proceed to next question, there is one question from chat list. Do you give certificate? We don't provide certificate to our participants. And one more thing, we would like you to submit your feedback. There is a form in our chat column, so please fill in the feedback for our future event, for facilitate future event better. All right. So the next question is from Sophie. Does it require at least 2% to do a systematic review?
Yes, I forgot to talk about the team. Okay, so when you want to conduct a systematic review, it is important it's important for you to have a team. Okay, let's say I understand sometimes you are a PhD student or a master student, you are alone, right? So what you need to do is that it's good to have someone is also doing a systematic review and you help each other.
All
Okay,
right.
so let's say if you want to do the search and then probably one person will do another search, it's good to have two-person to do it,
All right.
so that you can also even the screening process,
Mm-hmm.
data extraction process, you need two-person to do it. It's either you or your supervisor, or you or your colleague or your friend. Okay,
All
you
right.
need to do it in a team, because
Okay.
you want to ensure that you want to avoid bias later on. Okay.
Okay. There is a request from Young. Dr. Anita have a plan to for meta-analysis webinar later?
Oh, okay. To be honest, yeah, what we will usually do is that for systematic review or meta-analysis courses, we usually do with the clinicians. Okay,
Mm-hmm.
for example, okay, I was actually introduced to this systematic review process by my supervisor, my PhD supervisor, Prof. Yusumi and Prof. Encik Jen. So
Mm-hmm.
they are the EBM experts. So they
Mm-hmm.
include me as the co-speakers because I'm in charge for the searching part. So uh, you need to ask the faculty and see whether if they are interested to come up with to organize these workshops lah. So I will be part of that workshop. Yeah.
All right. So from Nur Aisha Abdullah, do we have also report the framework that we are using for the search in the paper, for example, Pico, spiders, etc.
No need, no need, no need. It's not necessarily to mention what is your PI and all, but it's
Okay.
good if let's
Mm-hmm.
say you mention what the populations and then all that lah. You need to
All right.
mention lah. Okay.
Okay, from Sophie for the research question, if there is no invention, can we justify it like this? Is A related to B?
Yeah. So what we can actually do is that, okay, another tips also, yeah. So we have PICO, right? So we have
Mm-hmm.
four components. So we
Mm-hmm.
have population, intervention, comparison, and outcomes. So
Mm-hmm.
the concept can just be two. For example, you want to search only population and outcomes, can?
Yeah,
Okay, because there
okay.
is no intervention. If
All
let's
right.
say if there is an intervention, you can
Mm-hmm.
include population, intervention, and outcomes.
All
So
right.
there are, and then sometimes intervention, there is also comparison. Yeah, you
All
can
right.
search PIC.
Okay.
So it depends. It depends
Okay.
on the question.
So there is two questions from Unanimous. How long does the systematic review have to be? And then the second one is, how important is it to have our topic registered?
Okay, first question.
How long?
How long?
Yeah, how long?
Okay. To be honest, it really depends on how focused are you with the review. Sometimes if you are doing many other things with the systematic review at the same time, it will take quite some time, okay, because you need
Mm-hmm.
to go through the whole process, by the first stage sampai the last stage, right? So it will take quite some time. It
All
can
right.
be like the fastest I've heard before is 3 months. Okay, I've
Okay.
heard someone come up with 3 months. The longest is probably 2 years or 1 year. Okay, and then second question was, why is it
Uh,
important to publish to
how important is it to have our topic registered?
Okay, it's very, very important because if it's registered, you can let the world know that you are working on that particular topic.
Mm-hmm.
So it will be ongoing study. So you don't want people to replicate or duplicate your work. Okay, we don't want to waste your time. To be honest, when I was doing my systematic review for the first time, I was not aware about this. Okay, I didn't even bother to search for the reviews available. Okay, I learned from mistake. So
Mm-hmm.
basically what I did was I did, and after a few steps, I already realized that, oh, actually there's already a published systematic review recently. So I
Mm-hmm.
wasted a lot of time. So that
All
is
right.
why it's important for you to register and make sure that you don't really waste your time, doing it, and then something, and it's already there,
All
so you don't
right.
want to waste your
Mm-hmm.
time. Yeah.
Okay. From Unanimous, do we have to pay for Pespero protocol registration?
No, it's free. It's free for
Okay.
everyone.
Mm-hmm. Okay, we have two questions from Sukuna. The first one is, if SLR comprise of qualitative and quantitative study, how do we interpret the result?
That will be the mixed methods lah. Okay, quali and
Mm-hmm.
quanti, right?
Yep.
Okay, that will be mixed method analysis. So that is another topic that the expert need to explain on that lah. Okay, because we have quali, quanti, and then we have quali and quanti together. So the analysis will be more on mixed method analysis.
All right.
Okay. Yeah.
Another question is, some quantitative study does have what is this AB effect of AB effect size. Thus, how do we do meta-analysis if we include this study in our SLR? I'm not sure what is AB effect.
Okay. All right. So okay, the thing is, and I think I get the question, although I don't understand what is the AB thing, but it's okay. What you need to know is that this is only the search strategy session, because we usually have a systematic review course on this topic. So it's good to get the expert. Okay, I think you can contact the faculty to see whether if there is any I think research training unit, if not mistaken, yeah. You can contact them and see whether is there any specialist, if there is any specialist that can actually help you with that meta-analysis methods. Yeah.
We have one question about Prospero from Sophie. Is Prospero the only website to register the protocol, or it depend on your research field? Can please share some of the registration website?
Okay, the most common one is Prospero. Okay, I recommend everyone to register in Prospero because it is commonly used by it is globally globally used. So I think it's good to register there. For clinical trials, let's see, if you are planning to do clinical trials, there is a clinical trial registry. You can actually use that also. I think there are another one registry that I can't remember what was it, but please, I recommend to use Prospero. Okay.
All right. There is question from Ainul, but I strongly suggest Ainul to directly contact Dr. Ranita. You can email Dr. Ranita to ranita@um.edu.my, because your question is too specific. All right. Another question from Sukuna. When we assess the article, for example, using Hammer critical appraisal, is there any standard of including the article if that particular article has both good, fair, and poor entry?
Okay, you're talking about the data assessing stage, is it?
Yeah, assessing the article.
Okay, so that will be another session. If let's say you're interested, probably we can have someone to guide you on that. Yeah. All right. We focus on the search one maybe this time.
All right. So one question from Faisal. How SR differ from bibliometrics?
Oh, okay. It's different. Okay, because bibliometrics probably won't have. Okay, systematic review, you have to understand that we want to make sure we come up with the best evidence. Okay, systematic review actually comes with because I think it started with the medicine field, right? So basically, from evidence-based practice, and then this is more on the clinical side. Okay, if you ask me, this is more technical. Being analyzed. Okay, the analysis is a little bit more different. Okay, bibliometric analysis is just to see the trends. Okay, maybe like you have the trend, right? You right, Faisal? It's like you want to look at the trend of that for that particular subject or for that particular year, for example. So it's a little bit different lah. Yeah.
All right. From Maria Wong, is there any librarian service in assisting the clinical research with database search? Yeah, you can email Dr. Anita, or you can contact any medical library. They will assist you on this. Okay. From Unanimous Attendee, are normal Google search considered as a gray literature?
No, no, we don't include Google search as your gray literature, but you have to directly go to the particular website that I mentioned just now, Open GrayNet, and all that. Yeah.
One more thing, one more question about gray literature from Chia Yang Tan. Are there any gray literature database focused on Asian context?
I think I've come across few. Maybe you can email me, doctor. Maybe you can email me. I'll try to get that back to you.
All right. From Unanimous, can thesis and preprint can be included in the review as they are not peer reviewed?
Actually, that is a very tricky question. Because we want to make sure our finding at the end of the day is a good published paper, okay? Because if it's a preprint, it is not being assessed and all that, right? So if possible, exclude that first and put aside. I'm not trying to say that don't include that. Please put aside. Probably we can work on that later, okay? But if it's good that you include published peer-reviewed paper,
All
okay?
right. I believe we have that time only, Dr. Anita, for Q&A question. For those who
Mhm.
are asking for the slide, we will give you the slide later, or else you can email Dr. Anita to have the Dr. Anita slide. And then the recording webinar will be emailed to you later. Okay. So, ladies and gentlemen, that's the wrap for our webinar session 10. I really hope that it will benefit all of you, and I'm very sorry on behalf of our organizer if we can't read your question, but Dr. Anita and most of librarian in like medical library are welcoming you to ask anything related to information seeking or information is that you need to know about the SLR. Okay, so on
Thank you
behalf
so
of the
much.
organizer, we would like to thank Dr. Anita for making time in her busy schedule, I believe, to, to join us here this morning. Before we end our question, we hope you can fill in our feedback survey. Please scan the QR code to to fill in your feedback. All right. So I hope we can meet again in our next research webinar series. With that, Assalamualaikum warahmatullahi wabarakatuh and stay safe, guys.
Thank you so much, everyone, for joining. Bye-bye. Take care. Stay
Bye-bye.
safe. Bye. You're welcome. Thank you, everyone.
Dr. Mo, do we have any postmortem or we can just leave this session?
Yeah, yeah. Uh, I think don't have any question. If you guys have any question to ask,
Come again?
you have any question want to ask?
Oh, Nope.
No, not at the moment.
Not at the
It's okay.
moment.
It's
Uh,
okay. I
uh,
also don't have any question on this. Later I will download all the video and then question and
oh,
then
you
request. Yeah,
you can stop the recording
yeah,
first, Doctor.
yeah. Sorry, sorry.
So you will send the link, the recording via emails, right?
Yeah.
Together with Dr. Anita's slides.
Yeah.
Hmm.
You want to me to send to everybody or just those requested one?
I for those who are registered, I believe.
Okay.
Because you can generate the email from the Zoom.
Yes.
Okay.
Mm.
Oh, what about next month, Doctor?
Yeah. Next month. You receive my invitation or not?
Yep,
Please.
I
Yeah.
received the
So
invitation.
you can reply the email and then maybe you can give me what is your the topic and
Oh, okay.
any background or subject of the topic I can put into the poster and then also the
All right.
picture of your picture lah, so I can put in for the design of the poster.
Okay.
Yeah.
Who's going to be the moderator?
Yeah, you can suggest anybody.
Or else
Yeah.
we can have Dr. Anita lah.
Yeah, sure. If she can free to be a moderator. Yeah.
Just
On
switch
this
the image.
Yeah, just switch
yeah.
switch the image
Yeah.
and change the background color.
Yeah. And yeah, and then the date is you will confirm the date or the date you
I believe I
suggested.
already confirmed the date, right?
Yeah.
It's on
So
20.
you not to have any changes on the date and the time.
So far I'm quite free on October.
Yeah. Okay.
All right. If there is no postmortem,
Thank you so much, Dr. Mo.
yeah.
Thank you. Thank you, Dr. Narita.
Have a
Thank
nice
you,
day.
Dr.
Yeah,
Mo.
have a nice day.
Okay. Okay, bye-bye.
Thank you so much.
Bye.
Bye-bye. Bye.
Bye.
Salam.